If you're watching this and thinking, is this about me? Stay right here. Because what I'm about to say in the next few seconds can save you months or even years of pain. If you feel burning, sharp pain, or pain that doesn't fade after it's over, your body is not adjusting. It's warning you. And ignoring it is where everything starts to go wrong. I'm Dr. Rachel Moore. I'm a gynecologist. And I need you to hear this clearly, without fear, without shame, and without sugarcoating. There is one sensation people are told to tolerate, one feeling they're told is normal, and it's the reason I see the same preventable injuries again and again. But before I explain why, let me tell you a story. A woman once sat across from me in my office, arms crossed, eyes fixed on the floor. She was smart, confident, put together. The kind of person you'd never guess was in pain just by looking at her. I asked her a simple question. So what brought you in today? She hesitated, took a breath, then said very quietly, I think something is wrong, but I don't know if it's my fault. That sentence alone told me everything. She described discomfort at first, then burning, then pain that lingered for hours, sometimes days. But I thought, she said, her voice cracking, that it was just part of it, that my body needed to get used to it. I leaned forward and said something she clearly had never heard before. No, pain is not the price of intimacy. She looked up at me like I'd just broken a rule she thought was unbreakable. And that moment, that's why this conversation matters. Because there is a massive gap between what people are told about certain sexual practices and what the body actually experiences. And in that gap, people get hurt. Now let me be very clear. I'm not here to judge choices. I'm not here to scare you. And I'm definitely not here to tell you what you should or shouldn't want. I'm here to explain what your body is saying when it sends you a signal you've been taught to ignore. Here's the uncomfortable truth no one explains properly. The body has different types of discomfort. There's unfamiliar sensation. There's pressure. There's mild stretching. And then there's pain that means damage. Before we begin, like this video and subscribe to the channel. Here, you get clear, honest medical information to help you protect your body and your health. The problem is, culturally, those lines get blurred, especially when someone wants to please a partner, or doesn't want to seem inexperienced, or has heard, it hurts at first for everyone. Let me ask you something. Have you ever thought, maybe I just need to push through this? That thought alone has walked more patients into my office than I can count. And here's where things get interesting. Because the body is actually very good at telling you when something is wrong. It just doesn't use words. It uses sensations. Burning is not neutral. Sharp pain is not neutral. Pain that lingers is not neutral. Those are not learning curves. Those are warning lights. But here's the twist. Most people don't ignore these signals because they're reckless. They ignore them because they've been taught not to trust themselves. I hear this all the time. It didn't seem dangerous. My partner said it was normal. I didn't want to ruin the moment. I thought my body was the problem. Let me say this as clearly as I can. Your body is not confused. Your body is not overreacting. And your body is not failing you. It's trying to protect you. And when it speaks, especially through pain, it deserves your attention. Now, I know what some of you are thinking right now. Okay, but where's the line? How do I know what's okay and what's not? How do I tell the difference? That's exactly what we're going to unpack together. But first, you need to understand something fundamental. Not all pain feels dramatic. Not all injuries happen suddenly. Some of the most serious problems start quietly, with a sensation people describe as uncomfortable but tolerable. Until one day it isn't. That's why I want you to stay with me. Because in a moment, I'm going to explain what's actually happening inside the body when those warning signs appear. And once you understand that, you'll never second guess yourself again. You'll know when to pause, you'll know when to stop, and most importantly, you'll know that listening to your body is not weakness, it's intelligence. But before we go there, I want to say one more thing. If you've ever felt pain and blamed yourself, if you've ever stayed quiet because you didn't want to be judged, if you've ever wondered whether you were doing something wrong, you're not alone and you're not broken. And by the end of this, you're going to understand why that signal matters so much more than anyone ever told you. Now take a breath, because what I'm about to explain next will change how you interpret your body forever. Now that you know the signal you should never ignore, we need to talk about why your body reacts the way it does. Because once you understand that, everything starts to make sense. The fear fades, the confusion disappears, and the guilt, it goes away completely. Let's start with something no one ever explains in plain language. The vagina and the anus are not built for the same job. I know that sounds obvious when you hear it like that, but stay with me. The vagina is designed for penetration. Its tissue is elastic. It stretches. It produces natural lubrication when arousal is present. Its structure is meant to accommodate movement, pressure, and friction with protection built in. The anus is different, completely different. The anus is a muscular ring, a sphincter. Its primary function is control and closure. It's designed to stay closed most of the time and open briefly for one specific purpose. That means the muscle tone, the nerve response, and the surrounding tissue behave in a very different way. And here's the part most people don't realize. The anal area does not self-lubricate. The tissue is thinner, and it's more prone to micro-injuries. So when someone says it hurts at first, that's normal, what they're really saying is your body is resisting something it wasn't designed to do without preparation. Resistance is not a flaw. Resistance is information. Think about it this way. If you bend your finger backward and it hurts, you don't say, my finger just needs to get used to it. You stop, because pain means something is wrong. Sexual pain should be treated the same way, but culturally it isn't. Instead, pain gets reframed as initiation, as a test, as something you push through to get to the good part, and that belief causes real harm. When the body feels pain, especially sharp or burning pain, muscles tighten, including the anal sphincter. That tightening reduces blood flow, increases friction, and makes the tissue even more vulnerable. So the more someone tries to push through pain, the worse the conditions become. This is where injuries start quietly. Small tears, tiny fissures, inflammation you don't feel immediately. And because they're small, people ignore them until they aren't small anymore. I've had patients tell me, it didn't hurt that much during, but afterwards something felt off. That off feeling matters. Pain that lingers after an experience is your body saying something was damaged, not punished, not challenged, damaged. And here's the part that surprises a lot of people. Serious problems don't always start with extreme pain. They often start with discomfort that feels manageable, tolerable, easy to rationalize. That's just part of it. Maybe I wasn't relaxed enough. Maybe next time will be better. But biology doesn't work on optimism. Tissue doesn't heal faster because you hope it will. Muscles don't relax because someone tells you to just breathe. And damage doesn't reverse itself because you ignore it. Now let's talk about pleasure, because this matters too. Some people experience pleasure from anal stimulation. That's real. Nerve endings are involved, and for some, the sensation can be enjoyable when everything is done with care, communication, and consent. But here's the key point I want you to hear. Pleasure is individual. Pain is not a requirement. If someone experiences only discomfort or pain, that doesn't mean they're doing something wrong. It means their body is responding honestly, and that response deserves respect. There is no universal experience. There is no standard reaction, and there is absolutely no obligation to push your body past its limits to meet someone else's expectations. I often hear people say, "But other people like it." That's irrelevant. Your nervous system is yours. Your anatomy is yours. Your comfort is yours. And no comparison changes what your body is telling you. When warning signals are ignored repeatedly, the consequences become more serious. Fissures can become chronic. Inflammation can turn into ongoing pain. The muscle can lose coordination over time. And what started as curiosity becomes something that affects daily life. Sitting, using the bathroom, feeling comfortable in your own body. That's not rare. That's real. And the hardest part? Most of this is preventable. Not by avoiding information, not by pretending risks don't exist, but by understanding how the body works and respecting its boundaries. I want you to notice something about how this conversation feels. There's no fear here, no judgment, no pressure, just facts explained clearly so you can make informed choices. That's what good medical guidance is supposed to feel like. Now here's where we shift, because understanding anatomy explains why the risk exists, but it doesn't yet explain how to protect yourself. And that's the next piece. In the next part, I'm going to show you exactly what separates a safe, respectful experience from one that causes harm. The difference isn't experience, it isn't toughness, and it isn't how much you're willing to endure. It's preparation and knowing when to stop. Stay with me. Let me tell you the mistake I see more than any other. It's not lack of desire. It's not inexperience. And it's not doing something wrong on purpose. The mistake is continuing after your body has already said no. Not verbally, physically. That burning, that sharp pain, that lingering discomfort you felt and tried to ignore. That's the moment where curiosity turns into damage. And the reason this happens so often is simple. People are taught to override their instincts, to second-guess themselves, to prioritize the moment over their own safety. I hear this again and again. I didn't want to stop everything. I thought it would pass. I didn't want to disappoint my partner. So they keep going, and the body keeps taking the hit. Here's what I want you to understand. When you continue despite pain, you're not just enduring discomfort. You're changing the conditions inside your body in a way that increases risk immediately. Muscles tighten, friction increases, tissue becomes more fragile, and that's where injuries happen. Let's talk about what those risks actually look like, without exaggeration and without fear tactics. First, fissures. Anal fissures are small tears in the lining of the anus. They can cause sharp pain, burning, and bleeding, especially during bowel movements. And once they form, they don't always heal quickly. Some become chronic and extremely painful. Second, bleeding. Bright red blood is never something to ignore. Even small amounts signal tissue damage. Repeated bleeding increases inflammation and delays healing. Third, infections. The anal tissue is thinner and more vulnerable. That means it's easier for viruses and bacteria to enter the bloodstream. This increases the risk of sexually transmitted infections compared to other types of sexual contact. And then there's something many people don't think about at all. Cross-contamination. Moving from anal contact to vaginal contact without changing protection or cleaning properly can introduce bacteria where they don't belong. This can lead to vaginal infections that are painful, persistent, and frustrating to treat. I've seen people stuck in cycles of infections simply because no one explained this step clearly. Now pause for a second. None of this is inevitable. These outcomes are not a guarantee. They are the result of missing protections. And that's where things shift from risk to choice. If someone decides to explore anal sex, there are non-negotiables, not suggestions, not preferences, requirements. The first is real consent, not silence, not okay, fine, not pressure disguised as persuasion. Real consent means enthusiasm and the freedom to stop at any moment without consequences. The second is time. This is not something that should be rushed. The body needs time to relax, to adjust, to respond. Speed increases risk, always. The third is lubrication, and I cannot say this enough. A lot of lubrication, more than you think you need. The anus does not self-lubricate. Without lubrication, friction causes injury quickly. The fourth is protection. Using a condom reduces the risk of infections and makes hygiene easier. This is essential, especially if there is any transition between different types of contact. And the fifth is the right to stop. At the first sign of pain, not discomfort, but pain, the experience should pause. Immediately. No debate, no convincing, no guilt. This is where respect shows up, because someone who cares about you will not want pleasure at the cost of your body. I want to talk directly to you for a moment. If you've ever felt like you had to endure something to be loved, desired, or accepted, that belief did not come from your body. It came from pressure. Your body is not a tool, it's not a test, and it's not something you owe anyone access to. Listening to pain is not weakness, it's self-respect. And here's the part that often brings relief when I say it out loud. You don't have to justify stopping. You don't have to explain in detail. You don't have to apologize. Pain is reason enough. Now I know some of you are thinking, okay, but when does this cross into something serious? That's the right question, because while many issues can be prevented by stopping early, there are times when waiting is not the right choice. And in the next part, I'm going to tell you exactly when you should seek medical help without delay. Now let's bring everything together, because information only protects you if you know what to do with it. I want to be very clear and very practical here. If you experience any of the following, you should not wait. You should not hope it goes away. And you should not tell yourself you're overreacting. Seek medical care immediately if you have persistent or heavy bleeding. If you feel intense pain that continues hours or days after. If you notice bright red blood mixed with stool days later. If you develop fever, chills, or signs of infection. If you feel a lump, swelling, or mass in the anal area. Or if you notice any loss of control with bowel movements. These are not situations where waiting it out helps. These are signs your body needs care. And I need you to hear this part, because this is where shame keeps people stuck. Doctors are not here to judge you. We don't sit there thinking about what you were doing or why. We're thinking about how to help your body heal and how to prevent things from getting worse. I've seen patients wait weeks, sometimes months, not because they weren't hurting, but because they were embarrassed. And every time, the outcome was harder than it needed to be. Please don't let shame delay care. Your health matters more than discomfort in a conversation. Now I want to step back and say something important. Something I want you to remember long after this video ends. There is no sexual practice that is worth sacrificing your physical or emotional well-being. Not curiosity, not pressure, not love. Not the fear of disappointing someone. Your body is not something to push past its limits to prove anything. If something hurts, you are allowed to stop. If something doesn't feel right, you are allowed to say no. If something isn't for you, that doesn't make you closed-minded, boring, or broken. It makes you honest with yourself. And that honesty is powerful. I want you to imagine something for a moment. Imagine a world where people trusted their bodies, where pain wasn't normalized, where boundaries were respected without explanation. That world starts with conversations like this one, and with people like you choosing to listen. Now here's where we look ahead. In the next video, I'm going to talk about something that ties directly into everything we discussed today. How to communicate boundaries clearly, confidently, and without guilt. How to talk to a partner before things go wrong. And how to protect yourself emotionally as well as physically. Because prevention isn't just about technique, it's about communication. And that conversation can change everything. Before you go, I want to ask you to do 3 simple things. First, subscribe to the channel so you don't miss the next video. These conversations build on each other, and staying informed is one of the strongest forms of self-care. Second, leave a comment telling me where you're watching from. I read them, and it means more than you know to see how many people around the world are choosing education over silence. And third, share this with someone who might need to hear it, not to scare them, not to shame them, but to protect them. Sometimes the most caring thing you can do is pass along information that could save someone from pain. Thank you for trusting me with a topic that deserves honesty and respect. Take care of your body, listen to it, and remember, your limits matter. If this helped you, like the video, subscribe, and share it with someone who needs to hear this. The right information can prevent pain, fear, and serious health problems.